For Rick Folbaum tonight, there are 197 confirmed cases of the virus across the entire state.
Nationwide, there are more than 8,000 cases and at least 145 deaths. The president signed a coronavirus relief package that includes free testing for coronavirus and paid emergency leave. Today, 2 members of Congress tested positive for coronavirus, a Florida congressman and a Utah congressman. In Georgia, Republican State Senator Brandon Beach of Alpharetta has announced that he tested positive and is now in quarantine. The lieutenant governor is also in self-quarantine after working with Senator Beach.
Meanwhile, we're working to learn more about the latest death at Emory Healthcare tonight. CBS 46's Trace and Bragg is live with the details.
That's right. Well, Brittany, the healthcare system announced earlier this evening about their first death related to the coronavirus. You can see I'm standing in front of Emory University Hospital here, but officials have not announced which location his death happened at. Earlier this evening, they sent a statement to CBS 46 that reads in part, "The Emory healthcare community is saddened to learn of the first death of one of our patients with confirmed COVID-19, despite the heroic efforts of our physicians, nurses, and care team." Emory says they are not able to provide any more details about the patient who died. Their first death comes on the same day they announced new hospital restrictions. Patients at the emergency room are now limited to one accompanying adult. Right now, we're going to continue to work for details to figure out exactly what led to this patient's death. You can count on CBS 46 News to bring you those details as soon as they become available. Reporting live at Emory University, I'm Trace and Bragg, CBS 46 News.
Trace, and thank you. Tonight, a South Georgia city is being called a coronavirus hotspot. Now, 2 deaths are confirmed at Phoebe Putney Memorial Hospital in Albany, and the number of the cases, well, they're growing fast. CBS 46's Barmel Lyons in Albany with the latest.
I've learned one victim, a 42-year-old woman, the other, a 69-year-old woman, both had pre-existing conditions. This hospital has quickly become a hotspot for COVID-19. They have 20 positive cases and 70 more suspected cases. They're still waiting on those results. We've learned the situation inside the hospital is becoming dire. The hospital's president says his staff has gone through 5 months of supplies in just the past 6 days.
We are scrambling. We're scrambling, and even to the point where these are N95 masks. We've got 3 days of supply of N95 masks on hand. In order to preserve these and get them to last longer, we've got a team of people sewing masks together. This is surgical sheeting, and this is our prototype. We've got about 3,000 of these made. We believe we can make 200,000 of them. It will take a few weeks, but this is the kind of what we're having to do because we don't know when that next shipment is coming.
The hospital president says he's been dealing with a severe case of price gouging. Those hospital masks usually 58 cents per mask. Now, Phoebe Putney has placed an order at a place in Mexico, but those masks, $7 per mask. In Albany, Barmel Lyons, CBS 46 News.
Barmel, thank you. Tonight, a nursing home industry group warning that many facilities could run out of protective masks and gowns by next week. The head of the American Healthcare Association says drastic action is needed. More than 15,000 nursing homes care for about 1.4 million patients nationwide.
And it's not just coronavirus patients that medical professionals are caring for every day. One local dermatologist tells us the shortage of masks is an issue they're facing as well, since their procedures also require masks.
It's an ethical dilemma. I do not want to use masks in particular any more than I have to because there are places that are on the front line.
Dr. Rutledge Forney says her staff wants to wear the masks, but they are mindful of what's happening. She also says fellow doctors are concerned the coronavirus will overshadow care for other health problems.
It's not just elective procedures being placed on hold. Doctors in virtually every field are altering their care as the coronavirus spreads. Surgeries for slow-growing cancers or early-stage cancers are now being delayed. Many stent procedures for clogged arteries are being pushed back, and infertility specialists are being asked to postpone helping patients until the outbreak eases. It all comes as beds and supplies are pinched at hospitals nationwide.
In Cobb County, an empty hotel in Marietta is now turning